Hi guys, my name is Jillian Kreimer. I'm here to present to you today about Perilymph fistulas. If you're not familiar with a fistula, it's pretty much a small hole or opening. It could be in bone, membranes, anything like that, and it just allows for something to pass through. So a Perilymph fistula, what exactly is that? It is a microfissure. So unlike on the next slide, I will show you a TM perforation. This is like a large fistula. A microfissure is unable to be seen by the human eye. So Perilymph fistulas, you really can't see them. They're occurring at such a small scale, but they cause some big problems. They can occur at the floor of the round window niche or near the anterior part of the membrane for the oval window, pretty much where the stapes foot plate is hitting the oval window. So where that connection's happening, you're going to find a little bit of tears. Sometimes you can find like congenital defects or just something that has been malformed, but typically this is not something that you see at birth. It kind of occurs due to like trauma, due to pressure, some kind of outside force. So what happens with these microfissures is that they leak perilymph from your inner ear into the middle ear cavity, and this causes a lot of problems for many reasons, and we will get into that in just a second. So again, I just wanted to show you the TM perforation because this is a good representation of what a fistula is, even though we can't see the ones that we're talking about today. So imagine this, but so tiny you need a microscope. So the anatomy that's really affected is the stapes foot plate and kind of everything surrounding it, because it's really that membrane that's affected. You're going to find the micro tears in the membrane. The cerebrospinal fluid is a large contributor to this, I guess I should call it like an affliction. It affects your middle and your inner ear space because both of those cavities are going to be kind of off balance. They're not going to be working the way they should. And the vestibular canal is also extremely affected. When the perilymph is leaking out of this system, I'll explain to you how it's kind of reacting with the cerebrospinal fluid, and it's causing some issues in your vestibular canals because it's activating pretty much your balance without, I guess, necessarily needing to. So like different pressure changes and stuff like that will cause you more of like dizziness and spinning where it shouldn't. So this was a really good picture because it shows a really awesome visual of the cochlear aqueduct, which we were talking about in class the other day, and I had the biggest question about what exactly it did, and now I know. So pretty much this acts as an equalizer between the cerebrospinal fluid and your perilymph. We know that perilymph has a very similar composition to cerebrospinal fluid, and this aqueduct pretty much just regulates the two. So when you have a perilymph fistula or a perilymphatic fistula, when the perilymph is leaking out and into the middle ear space, the hydrostatic pressure, which is pretty much the pressure of one fluid on top of another plus gravity, is going to increase because of the leak. And the cerebrospinal fluid will then push down on the perilymph, and I'm assuming will come through this aqueduct. Honestly, through the research, it did not mention the aqueduct, but it pushes down through there and pretty much replaces the lost perilymph, which could just cause a lot of issues because it's not as sodium rich as the perilymph, which you need in the system. So here I defined hydrostatic pressure for you guys. Pretty much it's the pressure exerted by a fluid at equilibrium at a given point within a fluid due to the force of gravity. So when you have force pressing down on the other one, they'll equalize. Perilymph leaks from the inner ear into the middle ear, and pretty much it's just replaced with the cerebrospinal fluid. It's a result of the pressure change. So the same way that your eustachian tube is regulating the pressure, the aqueduct is regulating a different kind of fluid pressure. So I thought that was actually really interesting. Kind of answered a question by accident. And this is another really good picture just showing you the whole system. I liked a lot how it showed you where the perilymph is traveling, and here you can see it like meets directly with the stapes foot plate right here. And you just kind of see all the overlap. So I thought it was a really good visual just to show you how the fluid would move and how everything would be affected in that kind of sense. So causes of perilymph fistulas, they are typically not present at birth, not always congenital. Head trauma is actually the most common cause. So like if you got a concussion ever in your life, or if you just hit your head, fell down the stairs, stuff like that, you can cause a lot of damage. I had no clue this was even something that could occur. So that was like shocking. Usually you're more worried about like your brain damage and stuff like that. I feel like the hearing almost falls to the wayside. So that was really interesting. Whiplash too, like from a roller coaster, or just, I guess, blunt force trauma. All of that is just, will cause little micro fissures and little tears. Tympanic membrane perforation, like if you have an impaction of wax and that tears, or if you're sticking a Q-tip in there too far, that could also be a cause. Rapid changes to intracranial pressure. So when you're going up or down in an airplane, or if you're going into the ocean, or you're hiking up a big mountain like Mount Everest per se, that can also cause some severe trauma to your ear due to the pressure change, and will cause these tears to occur. Another funny one that I kind of thought, which it's not that funny, but childbirth and weightlifting apparently put so much intracranial pressure on your head that you can burst your TM. You can create these little fistulas just by that pressure buildup. I thought that was really interesting because, again, it's one of those things that just, it's probably a very common occurrence, and it just is never diagnosed. And like, probably, I'm not going to say any numbers because I can't give you that kind of info, but a lot of the patients I feel like may be experiencing this and wouldn't even know it. Ear block, pretty much the sensation that you get when you're descending in a plane and your ear becomes so full. Scuba diving, same thing. It's just an increase of pressure to the point where trauma occurs. So symptoms of this disease, illness, affliction, pretty much it's persistent dizziness without true vertigo. So you're never completely spinning, but you're still going to feel like the little residual effects of vertigo. Nausea and vomiting are very common. Headaches, which can range from mild to severe. You could feel fullness in the ear, and this is kind of on or off. There's no real like scale on how severe that has to be in order for it to be a fistula. Fluctuating or sensitive hearing could also be a cause. Motion intolerance, like if you get car sick and stuff like that. Or you could have no symptoms, and people can also describe this as just feeling weird or feeling off. So sometimes that is an important thing for them to bring to us as audiologists, because they just say like, oh, I don't know, I'm feeling a little weird. And you then have to kind of probe them and look into their medical history to say like, oh, well, in the past few years, like, have you experienced any blunt force trauma? Have you experienced any kind of whiplash? Like, you have to kind of go through the motions and then diagnose them based on their history, I guess. It's really strange, and most people wouldn't know that they had like an actual issue occurring. They just feel a little funny. Vertigo can actually occur with it. It's not super common, but you can lose your hearing and you can experience true vertigo with this. It's just not a common symptom. Like I said, this is extremely hard to diagnose because you can't see them. So even with exploratory tympanometries, or oh my gosh, tympanotomies, thank you. You can't really get a good read on the situation. What I was reading was that you can see the fluid kind of leaking, but depending on the amount of fluid, there's no telling where the tear is or if there even is a tear. So they kind of, that was the old method of exploring and diagnosing because we didn't have the technology that we have. But now we have a better understanding, and we've decided that probing patients and asking them questions about their medical history is a really great way to figure out if anything would have occurred that could link this to a fistula. We also perform platform pressure tests, which are balance tests where they measure different things while you're standing on a platform, and they shoot different pressures into your ear, which I thought was really cool. I've never seen this done before. audiograms, which are rarely effective because sometimes you really are not experiencing a hearing loss. And on top of that, you can't diagnose a fistula based on hearing measures. They aren't related enough to make a definitive statement. Perilymph fistula tests, however, are a thing. And what this is it tracks your eye movements as the different pressures are being pushed into your ear. And I guess it measures how your eyes are reacting to it, which I thought was really interesting because I didn't really expect those two systems to be linked. Cool. MRI and CT scanning, these are our clearest picture because even though a surgeon can go in there, it's not typical they're going to see it, whereas on a CT scan, they'll be able to really get, I guess, the movement, and they'll be able to see any deficits. Or these I thought were really cool to include. The photo to your left with the woman wearing the VR headset, these are the goggles that track your eye movements during that Perilymph fistula test. And I just wanted to include that because I thought it was really cool. You could see her eyes in the background, and I don't know, I never saw that happen before, so I didn't know this was a test that could happen. And then the machine to your right is the machine that they use to insert the pressure into your canal. So they could shoot air, and I think it can also shoot water, which is really interesting. And they use different temperatures to kind of test for different things. So really cool, but those are the two things that kind of use them in unison. And that's one of the tests you could do. Treatment for these, they typically heal themselves on their own. Because they're so small, I guess they're easy to like repair within itself. Bed rest is typically your number one bet. They'll suggest before anything just to kind of lay low for the next 7 to 14 days. They really want you to kind of take it easy. They don't want intracranial pressure to expand or occur worse, I guess. I don't even know. And they say to avoid heavy lifting and physical strain. If your symptoms are persisting, they're going to tell you to seek audiological evaluation. Audiometry can be performed and other diagnostic tests such as the Perilymph fistula test in order to get like a better idea, as well as probing, which they will do just at the beginning of your assessment, just to make sure that there was no blunt force trauma that could have caused a fistula. Severe cases can get operated on. They will patch the middle ear and the inner ear. And pretty much a blood patch injection is the method that they now use, which takes the patient's own blood and inserts it into the middle ear canal in order to patch naturally the area, which I thought it reminded me of the vampire facial, which I'm not sure if anyone was familiar with, but I thought that was just really freaky because it makes sense. You're using your own stuff to heal, and it's probably the best way to get it done, but at what cost? And then this here, I pretty much just included like a little excerpt from someone who was describing the procedure. So they use general anesthesia. You're not under any kind of influence of anesthesia where you're asleep. You pretty much are awake. You can know what's going on. They lift your eardrum up and they fix the tissue around the stapes. And I thought that was really crazy because I did not know, one, that they could do that, and two, that they could do it while you were awake. The operation only takes about an hour, another shocking one, and there's not much pain. It's painless. I won't say painless, but little pain. And pretty much you're advised to spend 3 days at home with limited activity, and you have to avoid lifting 10 or more pounds for about a month and avoid sports. They really don't want you to like get up that intracranial pressure because that's just going to put a lot of pressure on the area, and it'll prevent the membrane from healing itself. After 1 month, additional restrictions are suggested, and activities that you do that are not following the doctor's advice can result in a recurring fistula, even if you've been successfully repaired the first time. These are my references, and I am excited to hear your questions. Have a great night, everyone, and Thank you for listening.